Hello and welcome back to our channel. Today we delve into an extensive exploration of lung cancer, a condition that affects millions worldwide. Our mission is to demystify this disease, shedding light on its complexities and implications. Whether you're a patient seeking information, a caregiver, a healthcare professional, or simply someone wanting to understand better, we've designed this video to provide clarity and valuable insights. Please note that while this video offers valuable information, it's not a substitute for professional medical advice. We encourage you to consult with healthcare providers for any personal concerns or questions. Let's embark on this enlightening journey together. Understanding lung cancer emerges when ordinary cells within the lungs undergo irregular changes, disrupting the natural process of cell growth and demise. This disruption leads to uncontrolled cell proliferation, forming tumors that can interfere with lung function and spread to other parts of the body. This spreading of cancer cells, known as metastasis, adds complexity to the disease. The initiation of lung cancer involves alterations in the DNA of lung cells. DNA residing within the cell's nucleus provides instructions for growth and functioning. When these instructions are disrupted, cells may begin to grow and divide abnormally, evading mechanisms that regulate cell death. Over time, these abnormal cells accumulate, forming tumors. Lung cancer, primarily categorized into two main types, non-small cell lung cancer and small cell lung cancer, presents unique characteristics. Non-small cell lung cancer accounts for about 80 to 85% of all lung cancers. It is relatively slow-growing and often has the potential for early detection through screening, methods like low-dose computed tomography scans. Small cell lung cancer, while less common, grows more rapidly and typically spreads earlier to distant sites. It's strongly associated with cigarette smoking and tends to respond well to chemotherapy and radiation therapy, although it may recur. Causes and risk factors. Among the various risk factors for lung cancer, smoking stands out as the most significant, contributing to about 80 to 90% of cases. Tobacco smoke comprises numerous carcinogens that harm lung cells, leading to DNA damage and increasing the risk of cancer development. Notably, exposure to secondhand smoke also elevates lung cancer risk, emphasizing the importance of smoke-free environments. However, it's essential to recognize that lung cancer can also occur in non-smokers, often linked to genetic predisposition, radon exposure, or environmental toxins. Delving deeper into risk factors, radon emerges as a substantial concern, particularly in areas with granite or shale bedrock. This odorless, colorless gas can seep into homes, posing risks if levels are elevated. Additionally, occupational exposure to carcinogens such as asbestos or arsenic in workplaces increases susceptibility to lung cancer. Air pollution, both indoor and outdoor, further compounds the issue, affecting individuals with compromised respiratory health or residing in highly polluted regions. Furthermore, a history of radiation therapy to the chest, initially used to treat other conditions, can inadvertently contribute to secondary malignancies like lung cancer. While lung cancer remains largely preventable through lifestyle modifications and risk factor reduction, understanding these factors is crucial for early detection and prevention efforts. Signs and symptoms. Early-stage lung cancer might not manifest noticeable symptoms, making it challenging to detect. As the cancer progresses, symptoms may emerge, including persistent cough, coughing up blood or rust-colored sputum, chest pain, shortness of breath, wheezing, hoarseness, unexplained weight loss, and fatigue. Recognizing these signs is vital for timely medical consultation and further evaluation. Diagnosis. Diagnosing lung cancer involves a comprehensive approach combining medical history review, physical examinations, and various diagnostic tests. Imaging techniques like X-rays and CT scans aid in visualizing lung structures and identifying abnormalities. Sputum cytology, where cells from the respiratory tract are examined under a microscope, helps detect abnormal cells. In addition, biopsies, either through bronchoscopy or image-guided procedures, enable direct examination of tumor cells, confirming the diagnosis and determining the specific type of lung cancer. This detailed diagnostic process ensures accurate staging, which influences treatment decisions and prognosis. Treatment options. Lung cancer treatment is multifaceted and tailored to the cancer type, stage, location, and overall patient health. Surgery remains a primary treatment for early-stage non-small cell lung cancer. Techniques like wedge resection, lobectomy, or pneumonectomy aim to remove the tumor along with a margin of healthy tissue. For advanced stages or inoperability, chemotherapy using drugs to destroy cancer cells or shrink tumors plays a vital role. Radiation therapy employs high-energy beams to target cancer cells, often used alongside chemotherapy or after surgery. Targeted therapy involves medications that block specific molecules involved in cancer growth. This approach, often employed after testing for genetic mutations, helps personalize treatment based on the tumor's characteristics. Immunotherapy, another advancement, utilizes medications to stimulate the immune system to recognize and attack cancer cells, offering new hope for many patients. Minimally invasive techniques like stereotactic body radiotherapy (SBRT) precisely deliver high doses of radiation to inoperable small tumors, offering a less invasive alternative. Comprehensive treatment plans often integrate multiple approaches, aiming to control cancer growth, alleviate symptoms, and enhance quality of life. Living with lung cancer comes with unique challenges that affect not only the patient, but also their loved ones. The emotional toll of a lung cancer diagnosis can be significant, ranging from fear and anxiety to sadness and anger. These emotions are natural responses to the uncertainty and potential implications of the disease. However, it's essential to acknowledge and address them through open communication with healthcare providers, mental health professionals, or support groups. Patients and their families might face financial challenges due to extensive treatment costs, including hospital stays, medications, and rehabilitation. Exploring insurance coverage, financial aid programs, and support organizations can help alleviate some of the burden. Additionally, lung cancer often impacts daily activities and routines. Fatigue, shortness of breath, and other symptoms can affect work, hobbies, and social interactions. Adjusting to these limitations requires patience, adaptability, and a strong support network. Open communication with employers, friends, and family about changing needs and limitations can foster understanding and assistance. Moreover, maintaining a positive mindset and engaging in activities that bring joy and relaxation can help manage the emotional and physical challenges associated with living with lung cancer. Encouraging and hopeful messages. A lung cancer diagnosis can be disheartening, but it's important to maintain a positive outlook and stay strong throughout the journey. Here are some encouraging and hopeful messages to uplift spirits and inspire resilience. With the right attitude, everything is possible. Zig Ziglar, renowned motivational speaker and author. Our greatest glory is not in never falling, but in rising every time we fall. Bruce Lee, martial arts icon and philosopher. Strength does not come from physical capacity. It comes from an indomitable will. Mahatma Gandhi, influential leader and activist. In the darkest of times, light will always find a way to shine through. Unknown, emphasizing the power of hope in challenging situations. Stay strong, stay positive, and keep fighting. You are braver than you believe, stronger than you seem, and smarter than you think. Ayman, beloved author, reminding us of our inner strength and resilience. Be strong and courageous. You may encounter setbacks, but never lose sight of your goals. Unknown, urging perseverance and determination. Never give up. Not only because life is worth it, but because you are worth it. Joel Brown, entrepreneur and author, affirming the value and worth of each individual. Hope is being able to see there is light despite all of the darkness. Unknown, highlighting the importance of hope and guiding us through difficult moments. No matter how dark the night, the stars will always shine brightly. Unknown, offering solace and reminding us of the constant presence of hope. Remember, you're not alone on this journey. Reach out to support groups, connect with others who understand what you're going through, and lean on your loved ones for emotional support. Stay informed, ask questions, and keep learning about lung cancer. Knowledge is power, and understanding your condition better can help you make informed decisions. Don't hesitate to seek professional help if you're feeling overwhelmed. Talking to a therapist or counselor can provide a safe space to process your emotions and develop coping strategies. Above all, keep hope alive. Hope is a powerful force that can sustain you through tough times. Believe in your strength and resilience and trust in the support of your loved ones and healthcare team. Stay positive and keep moving forward one step at a time. Wishing strength, courage, and hope to all those facing lung cancer. Your strength inspires us all and your spirit keeps us hopeful. Together, we can make a difference. Support, research, and awareness are vital in the fight against lung cancer. Stay informed, stay connected, and stay strong. Thank you for joining us today. And remember, even in the darkest of times, the human spirit can shine through with strength and hope. If you found this video informative and empowering, please don't hesitate to show your support. A simple thumbs up can go a long way in helping us reach more people with valuable health information. Stay healthy, stay informed, and stay strong. Until next time.